Good morning, dear students. We are going to discuss bony pelvis today. So, when we have done osteology, we have done about the sacrum bone. We have also studied about the hip bone. And at the tip of the sacrum, you are finding the coccyx. So, all these bones we have studied individually. Now, these three bones, like you are finding sacrum, coccyx, right and left hip bones, they are all actually forming a wash basin like structure, which is actually called as bony pelvis. Okay, which is so designed so as to lodge the pelvic visceral organs. Okay, so now you see here, this is the sacrum bone. See, base of the sacrum you have, these are the alae and sacral promontory, isn't it? And these are the sacral foramina. Then sacrococcygeal joint, and we have coccyx. So we have right hip bone, left hip bone. Between the two hip bones, we have pubic symphysis. Okay. Then what else do we have? Like, see, between the sacrum and the hip bone, we have sacroiliac joint. Okay. Now, the functions of this bony pelvis is it transmits weight in standing position. It protects the visceral organs. In females, you will see like the pelvis holds the fetus inside the uterine cavity, and it provides attachment to pelvic muscles. And with the help of pelvis, we actually can determine sex also. That means whether the pelvis belongs to male or female. That is for medico-legal examinations. Okay. Now see here, this is the pelvic cavity you are finding. Okay, this round area is actually called as pelvic brim. Area above pelvic brim is the false pelvis, also called as greater pelvis. And the area below this pelvic brim is actually called as true pelvis. Okay. So you are finding this is right hip bone, left hip bone. Okay, and you are finding like this is the pelvic brim level, above which we call it as false pelvis, and below which it is true pelvis. Okay. Now, there are certain dimensions in the pelvis, like we have two ischial spines. So if you take measurement between the two ischial spine, you will see it is interspinous diameter, which measures 25 centimeters. There is intercrestal diameter, which is moving from the iliac crest of right and left side. If you just measure here, it is 26 centimeters. So this is the pelvic inlet, where you are finding the sacral promontory in the iliopubic eminence coming towards the pubic symphysis. So axis of pelvic inlet, so it is upwards and forwards, passes through the umbilicus. So it is downwards and backwards, passes through the middle of the coccyx. Now let us see the various dimensions. So this is antero-posterior dimension AP, which is moving from the sacral promontory to the pubic symphysis, measures 10 centimeters. Then we have oblique dimension, moving from sacroiliac joint to iliopubic eminence. It is 12 centimeters. Then we have transverse, which is moving from one ischial spine to the other. It is measuring up to 12.5 centimeters. Okay, so three more diameters we have actually in case of females. We have obstetrical conjugate, which is moving from the sacral promontory to the symphysis pubis. This is 0.5 centimeters less than the anatomical conjugate. Then we have diagonal conjugate, which is moving from the, like in the lesser pelvis, we have from the sacral promontory to the symphysis pubis, which is approximate to the anatomical conjugate. So we have external conjugate, which is 19 centimeters, which is measured from the like sacral promontory, like upper part to L5, which is 19 centimeters. So this is pelvic cavity. So we have, this is the axis of the cavity, and we are finding formation like these are the lumbar vertebrae, sacrum, coccyx. This plane is pubic symphysis. and you are passing a plane from here, that is from the sacral promontory to the pubic symphysis at the upper part. That is the plane of pelvic inlet, and this is the cavity. And from the lower border of the pubic symphysis to the tip of the coccyx, the plane is plane of outlet. So now let us see what are the various dimensions we have. So the antero-posterior dimension in the pelvic cavity, which is from like S3 segment to the upper border of the pubic symphysis, it measures around 13 centimeters. We have oblique, which is measuring around 13.1 centimeter, and transverse is 12.5 centimeters. So this is pelvis has been tilted. Hence, you are seeing this outlet as though this point is for the outlet of the head of the baby to come out during the process of labor. You are finding this is pubic symphysis, right and left pubic bones, acetabulum, and these are the ischial tuberosities. Okay, and then you are finding there is sacrum to the ischial tuberosity. We have sacrotuberous ligaments. Okay, then. So in the pelvic outlet also we have certain dimensions like antero-posterior dimension measuring from the coccyx to the pubic symphysis, which is 12.5 centimeters. Transverse is running between the two ischial tuberosities, which is 8.5 to 11.8 centimeters, and the oblique is 12 to 10 to 12 centimeters. Okay, the oblique goes like this. So that is moving from the middle of the sacrotuberous ligament to the midpoint of the ischiopubic rami. We have the oblique dimension measuring 10 to 12 centimeters. Now coming to the shapes of pelvis, we have different shapes like gynecoid pelvis, round shape, android, heart shape, anthropoid, oval shaped, and platypaloid, flat shaped. Now, the gynecoid pelvis is actually the typical type of female pelvis. What we have is the gynecoid pelvis, so which is found in 50% of females, women. It is rounded or slightly oval outlet, this one. Then, so straight pelvic side walls with roomy pelvic cavity, good sacral curve, ischial spines are not prominent, and pubic arch is wide. Okay, so this is gynecoid. Then next we have android. Android in the sense male pelvis. So typical male pelvis, we have pelvic brim in heart shape. Okay, this is android, and you can see this is the pelvic brim which looks like a heart. Okay, so pelvis funnels from above downwards, convergent side walls, narrow pubic arch, and prominent ischial spines. Then we have like the other types like anthropoid and platypaloid. So the pelvic brim, where you will see the antero-posterior diameter is greater than transverse diameter, long and narrow pelvic canal with long sacrum, straight pelvic side walls. Okay, so that is, you can see this is anthropoid. Okay, so anthropoid you will see in gorillas, monkeys, apes. Then flat pelvis is actually called as platypaloid. So platypaloid is found in around 3% women, where pelvic brim, the transverse diameter, as you can see here, it is much greater when you see with the antero-posterior diameter. In this picture, you can see this is the transverse diameter and this is the antero-posterior diameter. Hence, you can see the transverse diameter is more than 3 times greater than the antero-posterior diameter, and pelvic brim looks like a kidney shape. Sacral promontory is pushed forwards. So these are the various different types of pelvis. We have gynecoid is the typical female, android is typical male, anthropoid is apes, monkeys, platypaloid is flat pelvis. So according to the measurement of pelvic inlet, you will see if antero-posterior diameter is long, it is called as dolichopelvic. Then mesatipelvic, you will see transverse dimension is long by 1 centimeters. Brachypelvic transverse is long by 1 to 3 centimeters. Platypelvic transverse is long more than 3 centimeters. Now the differences between male and female pelvis is always a short note. Now when you see the general structure, Female pelvis is light in weight and it is thin when you hold. And male pelvis is very heavy and it is thick because the bone weight is very thick and heavy. And the greater pelvis, that is, this is the pelvic brim above which we call it as greater or false pelvis. It is shallow in case of female, whereas it is deep in case of male. Pelvic inlet, larger and more oval, whereas pelvic inlet is smaller and heart-shaped in case of males. Acetabulum, this is acetabulum, right? Which is small and facing anteriorly in females, and it is large and faces laterally in case of males. Then this is obturator foramen, which is oval in case of females and it is round in case of males. Then this is the pubic arch, which is greater than 90 degrees angle in case of females and it is less than 90 degrees in case of males. Okay, so we have few more differences like male and female pelvis. Pelvic bones are heavier in males and lighter in females. Muscular impressions are more prominent in case of males and less prominent in case of females. Then iliac fossa, this is the iliac fossa. It is more concave in case of males and it is shallow in case of female. Then anterior superior iliac spine is interned in case of males and it is actually straight and forwards in case of females. Ischiopubic ramus, this is the ischiopubic ramus, right? So this is the ischiopubic ramus, thick everted so as to give attachment to the crus penis, and it is thin and not everted in case of females. Acetabular cavity, it is large in males and small in females. Then, so transverse diameter of acetabulum and distance from symphyseal surface of pubis to anterior margin of acetabulum are equal, whereas longer than transverse diameter of acetabulum. That means transverse diameter is actually longer. Then obturator foramen, we have already seen. Then preauricular sulcus is this point where I'm showing you the arrow. So this is large and oval in case of males and small and triangular in case of females. Okay. Then articular surface of the body of S1. That is the first sacral vertebra, larger than ala of sacrum in males and smaller or equal in case of females. Then pelvic inlet, heart-shaped in males and round in females. Pelvic cavity, we have seen symphysis pubis. In case of males, it is elongated and in case of females, it is short. Then you will see there is one line, that is the chylotic line, iliopubic eminence to anterior margin of auricular surface of ilium and then to iliac crest. Okay, so this is the iliopubic eminence to the anterior margin of the auricular surface, this one, of the ilium and then to the iliac crest. This is the iliac crest. From here till here, this line is chylotic line. So then the anterior segment is shorter in case of males and it is longer in case of females. This is the anterior segment. It is short in males. This is the anterior segment. It is longer in females. Pelvic outlet small, like 1 inch less in all diameters in case of males. Wide. Anteroposterior diameter is longest so as to facilitate the delivery of the baby. Head of the baby should pass out through the pelvic outlet. Hence you will see all dimensions are wider in case of females. Then this is the subpubic angle, right? So this subpubic angle in case of males, it is narrow 50 to 60 degrees. Whereas in case of females, it is wide 80 to 90 degrees. Angle and depth of greater sciatic notch. This one is the greater sciatic notch of male, which is narrow and it is quite wide in case of females. Then these are the ischial spines, right? This is the ischial spine. So these are interned in males and these are outturned in case of females. Okay. Then apart from that, we also have certain other differences related to the sacrum when you see male and female sacra. Now the sacrum in case of male, it is long and narrow, whereas in female it is short but wide. Sacral index is nothing but the maximum breadth in into 100 divided by the maximum length of the sacrum. This is the maximum breadth and this is the maximum length. Breadth is multiplied with 100 divided by length, and in males the sacral index is 105, females it is 115. Now the curvature of pelvic surface, it is uniformly concave in males, whereas it bends twice between S2 and S3, and between S4 and S5 you are finding the bending. Then this is the auricular surface, right, where you will see the corresponding auricular surface of the ilium of hip bone actually articulates to form sacroiliac joint. The auricular surface in case of males involves the upper 3 sacral segments, whereas in female it involves upper 2.5 sacral segments. So coccyx is immobile in males and it is more mobile in case of females. Sacroiliac joint has limited movements in males, and in females you see rotatory movements during pregnancy. So overall you can see the pelvic inlet, it is like oval, whereas in case of males it is heart shaped. This is pelvic outlet. Okay, pelvic cavity, it is funnel like in males, whereas it is wide in case of females. Pubic arch is also wider in case of females when you compare with males. Now there are certain conditions where we have pelvic deviation, which may be due to some congenital. By birth itself there may be some defects. There may be narrow pelvis or flat pelvis, or like narrow outlet funnel shaped assimilation. It may be because of some underlying diseases like rickets, rachitic pelvis, which is called as the bones have become very soft, you call it as osteomalacia. Tuberculosis also will damage the hip bones and sacrum, deranging the pelvic cavity. There are clinical conditions of deviated vertebral column and pelvic cavity associated. We have lordosis, scoliosis, kyphosis, and spondylosis. So what is the difficulty if there is any deviation like that? So if there are, generally we take pelvic dimensions for the purpose to check if the lady can go with a normal labor, normal delivery or not. If we find any of these pelvic dimensions less than normal, as we usually see in polio cases, we have to plan for like elective cesarean section. That is the purpose of studying the pelvimetry, also called as pelvic dimensions. So in case if pelvic dimensions are not normal and if they are falling less than normal dimensions, it may lead to prolonged labor. That means the labor time is more than normal, and cephalopelvic disproportion. That means head is getting like locked over there and it is stuck and it is not coming out through pelvic outlet. So that is head of the baby is quite big when you compare with the pelvic dimensions. That's what is cephalopelvic disproportion. Breech presentation, that is basically you will see head of the baby should come out through pelvic outlet in normal delivery, but in this case you will see instead of head coming out first, sometimes limbs may be seen, buttocks may be seen, anything coming out in front like at the pelvic outlet presentation, then you call it as breech presentation. So because of this like improper pelvic dimensions, the lady may also suffer with infertility. Thank you.